There are many YouTubes discussing the topic of whether dental implants are safe, but the reason that you've come to this educational platform is to learn about the critical information that nobody else is sharing with you, and that is vital so that you can make the correct decision with your best interest at heart. I'm an implantologist with 30 years of clinical experience, and I have placed and restored 16,000 implants. In this video, we will discuss the important factors such as what can potentially be one of the biggest mistakes made by dentists during implant placement, how numbness of the patient's lip can be avoided, a simple way of how to assess if you are allergic to titanium, which I must emphasize is extremely rare, and how to save money with dental X-rays and avoid unforeseen costs. Our goal is to discuss the truth from the media hype and present you with scientifically backed information. Your time is precious and your health is invaluable. Thank you for investing your time with us. Dental implants are generally considered safe, but like any other surgical procedure, they carry potential risks. Dental implants are typically made of biocompatible materials like titanium and zirconia. Biocompatible means materials that are safe and do not cause harm when in contact with living tissues, like human bone. The first time that a dental implant procedure was completed using titanium was in 1965 and was performed by an orthopedic surgeon by the name of Brannemark, who I was fortunate enough to have met in later life. Since that date, there have been approximately 400 million implants placed worldwide, and approximately 3 million patients in the United States have received dental implants. Among the different materials found on the market, titanium implants are the most used due to their biocompatibility and low cost. The incidence of titanium allergy is less than 0.6% of the general population. Simply put, having a titanium allergy is like finding a needle in a haystack. Out of every 1,000 people, less than 6 individuals would be affected by this allergy. One of the simplest ways to determine if you have an allergy to titanium is by doing what we call a patch test. Simply wear a titanium ring for a few days and then examine the skin for any signs of allergic reaction or irritations. Alternatively, and more expensively obviously, a blood test can be conducted to check for specific antibodies that would indicate an allergic reaction to titanium or to rule out any other potential causes of the symptoms. The most important thing to note is that if you have received a dental implant, you will not beep when going through an airport metal detector. Despite decades of titanium being the gold standard in oral implantology, the search for alternatives like zirconia have been growing due to factors like aesthetic demands, titanium allergy, and the desire for metal-free options. While zirconia has shown to be a potential substitute, early failures and technical challenges remain, and further research is needed to fully determine if the reliability and strength of zirconia exists in comparison to titanium implants. It is important to note that the first time that a dental implant procedure was completed using zirconia oxide was in 2005. And it is also important to note that although zirconia is not a metal, it is a metal oxide as it appears in the periodic table. In summary, it is relatively early days for zirconia implants, and we simply don't have enough long-term scientific data on their performance and on their safety. It is of paramount importance that a thorough evaluation of your oral health and your medical history needs to be done to ensure suitability for any implant procedure. As part of that thorough clinical evaluation, it is vital that a CBCT X-ray needs to be taken. A CBCT is a type of 3D X-ray, and CBCT is a fancy name, and it stands for cone beam computed tomography, CBCT. And it is paramount for dental implant planning, as it provides accurate 3D images to assess bone quality and nearby structures, determines implant placement, enables customized treatment planning, reduces risks, and enhances patient communication for improved accuracy and success in dental implant procedures. I cannot emphasize enough how important it is. For 7 principal reasons, I'm going to share this essential scientific information with you that sadly nobody else is doing. Accurate 3D imaging provides high-resolution 3-dimensional images of the patient's oral structures, including their bones, teeth, nerves, and surrounding tissues. This detailed view allows dentists to precisely assess the anatomy and plan the implant procedure accordingly. Your classic black and white flat X-ray is referred to as a 2-dimensional X-ray, and alas, do not provide this type of information. The CBCT helps in evaluating the quality and quantity of available bone, which is crucial for determining the feasibility and success of dental implants. It ensures that the implant is placed in an area where there is sufficient bone, which is essential for the long-term stability of an implant. The analogy I always use with patients is, if you are building a house, you want to place the supporting pillars in concrete rather than in cement because concrete is stronger. 3D X-rays show you where the concrete is. 3D images enable visualization of the nearby anatomical structures like nerves and sinuses and adjacent teeth. This information is vital for avoiding potential complications during implant placement and ensuring that the implant doesn't interfere with the surrounding structures. If you strike a nerve during implant placement, you may lose sensation. And if you strike an artery, you will bleed. These images allow for accurate planning of the implant's position, angle, and depth. It aids in avoiding critical structures, achieving optimal implant alignment, and ensuring that the implant fits well with the patient's bite and aesthetics. They also lead to more predictable and successful outcomes for dental implant procedures because the dentist can customize the treatment plan based on the patient's unique anatomy and needs. Cone beam images help minimize the risk of complications during surgery by providing a comprehensive view of the patient's oral anatomy. This understanding of the patient's specific situation reduces the likelihood of errors or unexpected issues during the procedure. Simply put, I always say to patients, I'm a surgeon and I don't like surprises. And as a patient receiving treatment, you also don't like surprises. In conclusion, these images make it easier for the dentist to communicate treatment plans and potential outcomes with their patients. Visualizing the procedure can help patients understand the importance of the treatment and make informed decisions about their oral health. I encourage patients to take their time and read the technical report that comes with a CBCT X-ray. You are paying for it, and so therefore the X-ray as well as the report is yours. And here are some tips that you need to look out for. Has the X-ray been reported on by a reputable professional? Is the report a 1-paragraph report or is it a 1-page report? The value of a report is in the precious detail. Unfortunately and sadly, as experienced clinicians, all too often you hear about patients reporting that they had an implant previously placed somewhere else and that practitioner that treated them charged them for additional costs after the procedure because a bone graft had to be performed. 3-dimensional X-rays prevent this from happening, and there are no surprises. And I've already shared my views with regards to surprises. Please laugh. So, in summary, it is imperative to ask the dentist who you are consulting how many of these procedures have they completed. We will elaborate on this classified information in a lot more detail in episodes 90, 99, and 101 of the Patient Education series. And as always, listen to your intuition. Your intuition is always correct in 3 ways. It always is in response to something. That something is not always tangible. Plus, it always has your best interest at heart. If a patient is unsure of the proposed treatment, for whatever reason, go and get a second opinion. But please take the cone beam X-ray with you and double check that the X-ray is what we refer to as open source, which means that the software can be viewed by anyone. This will prevent you as a patient having to be radiated a second time without necessity and obviously the cost. Finally, I'd like to share with you that the success rate of dental implants is generally very high. We will converse about this hidden topic in a lot more detail in episodes 8 and 27 of the Patient Education series. In the hierarchy of evidence-based medicine, systematic reviews and meta-analyses are considered the absolute top. According to a systematic review and meta-analysis published in the leading international journal of oral and maxillofacial implants in 2019, the science showed that the overall survival rate of dental implants was reported to be approximately 95.1% after 5-year follow-up. The study analyzed data from numerous clinical trials and observation studies to determine the success and survival rates of dental implants. As a comparative analogy, only 70 to 90% of motor vehicles are still in working condition after 5 years, even if they've been properly maintained and regularly serviced. If you find the content of this video valuable, we encourage you to like and subscribe to help us expand this educational platform. Remember, the path to good health lies in evidence-based scientific research. Stay tuned to our next podcast, where we will dive deeper into the topic, how much do dental implants cost, and provide you with valuable insights.